At 6:30, we have heard the story before of climbing costs when it comes to health care, having to force you to choose between medicine and other expenses. A St. Louis area health nonprofit agrees, but is speaking against legislation that could cut out-of-pocket costs for patients. First Alert 4's Dion Broxton explains why helping some could hurt more.
My father had hemophilia. I'm a carrier. My son has hemophilia.
Bridget Tyree sees firsthand how expensive specialty drugs are for people with rare disorders.
If they don't have medication, they can end up with long-term arthritis, hospital stays. So it's going to be more expensive in the long run.
She is the executive director of Gateway Hemophilia Association, one of dozens of organizations backing legislation to force health insurance companies to end copay accumulator adjustment programs, or CAPS, in Missouri for the fourth year in a row. The practice essentially allows insurers to exclude applying a separate pool of funding to out-of-pocket costs for consumers who rely on specialty drugs.
Discriminate without discriminating.
Which means consumers could pay more than they have to for certain medications.
These copay accumulator programs only came about after the cost of drugs started going up so dramatically.
And the building behind me, a St. Louis nonprofit, agrees the cost of health care is skyrocketing, but it disagrees with this legislation, saying it is not equitable.
The cost of the copay programs are embedded in the cost of the drug.
Louise Probst is the executive director of a St. Louis organization representing the health care needs of many businesses across the region. Probst, who is against banning copay accumulator adjustment programs in Missouri, says people with copay cards will end up paying less for specialty prescriptions compared to those using more common medicine.
If pharmaceutical companies want to make their drugs more affordable, they should take the money from the copay accumulator cards and take it off the price of the drug.
Probst says if this proposed legislation is passed, then health insurance agencies, businesses, and employees who don't need specialty meds will end up paying more for premiums.
The employee over here is going to have to pay that increase. The employee that has a copay card will not.
Tyree says 19 states have already banned copay accumulator adjustment programs, and the majority didn't increase premiums.
It's an assistance program, so patients should be able to use that assistance program.
Neither the House or Senate bill have made it to the floor yet for debate in Jefferson City. Dion Broxton, First Alert 4.